she's going to talk to us about optimizing results but minimizing downtime, and talking about stem cell technology and things like that. So this is going to be really interesting. Beatrice, I'll hand over to you in a second, and what we'll do at the end is I will come on and answer any questions that have been asked. So if anyone's got questions, feel free to add them into the chat, and we will get Beatrice to answer them at the end of her presentation. So I will hand over to you now, Beatrice, and I will see you in a little while.
Lovely. Thank you very much, Vicky. And I'm delighted to be joining you today. It's a very nice sunny day in Somerset today. So I'm sure a lot of people will probably have a bit of sunshine and a glass of wine, but hopefully you can bear with us for a little time. Just share with me this opportunity to talk about this stem cells technology. So if I go a little bit through the agenda, we can see we're going to do a little bit of first of introduction of the professional CALSIM range, and then we're going to talk a little bit about the umbilical cord lining technology, some of the applications in wound healing, and of course what we can achieve in our clinics regarding our aesthetic results by using this range. So let's have a look first at the portfolio. It's very nice and simple, just these 3 beautiful products. So number 1 will be our individually wrapped with normally a screw cap and then a separate pipette. And each one is individually wrapped because you can use this one for the treatment, after your treatment for the patients, and obviously give it to them to continue at home for several days afterwards. Then we have 2 products, the multi-action cream, which is more for patients with more significant signs of aging, so your more mature patients. And of course, we got also the restorative hydration cream for patients who need more of exactly what it says, hydration, and you want to improve skin texture at the same time. So very nice and simple, as I said, 3 products. So your serum will be the one to use in clinic after any of the procedures. And it obviously is supposed to be used with any invasive procedures. So we got a list there. So types of lasers, like for example, CO2 or normal IPL, or even just normal lasers, HIFU, microneedling, microdermabrasion, the more severe chemical peels, radiofrequency. We're talking more about sublative radiofrequency, again, when you're, or ablative radiofrequency, and anything like that, including the plasma surgical. So see that the treatments you do, and again, is invasive. And particularly on this patient, I have to make an special mention, because it's probably made for us a huge change, because people didn't really want to have plasma surgical because of the severity of the swelling and the downtime. And since we added the CALSIM, and that's part of our protocol, the must have it with CALSIM, then obviously we have found that the downtime is hugely diminished, and people actually can do pretty much a normal life. And of course, as we said earlier, after that, you can continue giving them this serum if you feel it's adequate for them, and then they use it twice a day with a clean skin. So they cleanse and they use this serum. And then if you feel it's appropriate, you can also give them one of the creams to use day and night, or you can use one in the day and one in the night if you feel they need a combination of both. So looking first now at the umbilical lining stem cells technology. So how does all work? So let's have a look first of obviously stem cells. We know the stem cells are our precursor cells. They're the ones that are going to differentiate themselves into obviously another 3 main lineages. So you got your hematopoietic stem cells, which are the precursors for blood cells, the epithelial and the mesenchymal stem cells. And as we know, on our skin, we got obviously your epidermis, where we got the epithelial stem cells, and then we got our dermis, where we have got the mesenchymal stem cells. So what we know is the skin itself is going to be perfect to have this responsive to this type of stem cells technology. So they're going to be very sort of keen to have these signals, and they're going to promote the healing and to promote a number of things as part of the acceleration process. So With epithelial stem cells, obviously, we know that we're going to have these tissue cells precursors, so as part of that. And of course, with the more mesenchymal stem cells, it's more about solid organs and tissue cells precursors. But of course, as part of that, we also got the dermal fibroblasts, which obviously they will encourage with these cells. So then looking now at our next slide, what is very important from this is to take the message that you're going to need at least a 30% concentration to be able to have that skin absorption and to actually be used and to be working. If you have less than 30%, you're not really going to have the effect you are looking for. So really, as I said, 30% needs to be your minimum. And of course, the second important thing is the quality of the stem cells. We do know, and we'll see that in a minute, and there is a lot of ways to get stem cells technology, but what we do know that is obviously the infant stem cells of the core lining are going to be the most vigorous, the most active, the ones that are going to be really doing the job properly because they're young and they're strong, they're robust, and also because they're easy to work with. So again, let's have a look at that. So if we see the cells in there, we know they're very smooth and they're actually producing mucin, which means they're going to be resistant to contamination. Now that's very important because when you're working in a lab, the last thing you want is things that can get contaminated and get problems in the future. They are avascular, they're very robust, and as we said earlier, they're very, very easy to work in the lab. So, and we produce from this umbilical core lining stem cells, we're going to be producing those two wonderful epithelial and mesenchymal stem cells that we require. So let's have a look at that graph because this is showing us the different areas from where we can have or different sources or where we can get this stem cells technology. And just very quickly passing you to this one because just the key points from that slide will be that from the umbilical core lining, we can get 6 billion of epithelial stem cells and 6 billion of mesenchymal stem cells. When we look at the bone marrow, which obviously, first of all, they're adult stem cells, there's only 2 million of only mesenchymal stem cells. When we look at the tissue, less. Go for that. Of course, with placenta, there can be issues as well for contaminations. What you want as well is the fact that with one single umbilical cord, the first grow, you're going to have a harvest and multiple harvests. So, for example, in this case, we can get even 30 growth generations. When we look some things at Wharton's jelly, will be quite a variable thing. So, going back here at what we were saying earlier about we need at least 30% to be able to penetrate the skin and to actually do the work. So in this case, I can say, and that's what I said earlier, that the Calycine Professional Serum was the star or the key product of the range, because as you can see here, we have got an 80% of stem cell derived proteins, which is huge and is definitely the biggest in the market. And even the creams, which are the ones where we see for skincare at home, we have got the multi-action with a 50%. And on the restorative hydrating cream, we have got a 40%. So very good. So definitely very high and definitely the highest at the moment in the market. So it's just good quality and good concentration to do what it tells you in the bottle. But why? Why do we use these specific stem cells? Where do they come from? Is from the New Zealand red deer. And the reason these very clever individuals have found is because it's the only animal which does not transmit any disease to us humans, which means we can work very safely with this. Now, what happens is these beautiful deers are not in captivity. They are free. They are no endangered species. They have been treated really nicely. So there's no like we're using them. We are using just that umbilical cord, which once the baby is born is just a medical waste. It will be just burned or throw away. So that means we can use the umbilical cords, work with these on a safe environment and create these products. And this is not going to be able to work at the moment on this screen. It's a very small video, which I wanted to show you, but unfortunately because of the system, but you can see the cells in there, and what you will see in the video is they move really, really active and very vigorous. It's from the University of Colorado, and it was captured by Dr. Robert Chang. And it's just really to see the amount and the quality of these cells, because it's beautiful to see on these images. So let's have a look. How then we get from these stem cells from the umbilical cord to the red deer to these products? So what happens? So it's all about the medium. So really, the core lining stem cells are going to be producing a very huge mix of proteins and of growth factors and cytokines, which obviously they'll be collected in this conditioned media. Now, this conditioned media is obviously all filtered, all taken away, and that's what you get left is all these active ingredients, which then will be used, they will be acting as a very, in a youthful manner. So they're going to really send these messages to the skin cells. And what's happening is we're going to get an increase on glycoprotein production, like for example, hyaluronic acid. We're also going to encourage them to be moving in the direction we want, which means they can actually improve for wound healing. They're going to be closing the wound, and they are also going to increase the turnover of the cells. So they're going to be active, young, and strong. For this, I wanted you to see all these in vitro studies. We got quite a few, and it's very, very important to understand this behavior. Obviously, we know it's in vitro, but obviously you can replicate things. So in this one is an evidence of the increased epidermal proliferation of the cells. So what we're using here is aged skin keratinocytes and fibroblasts. And what we can see even then from day 6, there is a very increase of more than 42% of the on the area where they've been activated. So you got the gray ones, which obviously are the ones that are not exposed to the medium, and in the red column we have got the ones exposed to the calycine. So we can see obviously it's the significant responsive of the skin and the increased growth and proliferation compared to control in today's slide of 42%. And then looking at the next one, this one is using a lactic acid culture for obviously wound healing. So you do like a scrap test. It's like a little wound testing, and you got the control and the calycine one. And you can see from day 1 and how just over 40 hours, the epidermal cells, which they were exposed to the calycine, have proliferated a lot more and actually migrating faster to close that scratch, so to heal the skin on that way without any evidence of any cells toxicity and no other problems. So really it's a great image to see, great result, and just in 40 hours. And this other one is actually using a mimic of what a skin model will look like, three-dimensional in vitro skin model. And again, we're representing the exposed cells to the calycine, and obviously how that increase over, as we said earlier, of the glycosamines and everything else will actually increase the skin fullness and the thickness of the skin on the area where it's been treated in comparison to the one not exposed to calycine to at least 600%, which actually again is extremely significant. And finally, we thought it would be good to see a comparison of what actually the pipette tip scratch test, as we've seen earlier, will be on just calycine, but this time rather than a control compared to human foreskin fibroblast condition media, because we know that human foreskin was used quite a lot in the past for this. And in the first slide here, what we see is both injuries have been caused at the same, so they look pretty much identical. This is day 0. And then moving now on to the next slide, we can see what's happened at day 5. And as we can appreciate from the photographs, the calycine is totally healed, where obviously on the other one, we can see there is obviously an improvement, of course, and we know it works. It's amazing. It's better, but it's not quite as strong and as efficient as the calycine in itself. And obviously, I wanted to show you some images, and I know most of you are not going to be working on these type of things, but this is just to see how incredible by using this condition media on the repair of these chronic ulcers. I mean, we can see here that, you know, this person was having treatments for ages. I mean, I think it was 10 years exactly on this one, and no improvement. And suddenly, over 2 months of treating and dressing it with this media, look at the healing. I mean, it is incredible. So there is a lot of studies going on at the moment from wound healing, so we will see more and more coming. This one, you see, is more close to our hearts, because if you have the unfortunate of have a complication with some dermaphilas, or you see someone who is referred to you, it's very difficult to know sometimes when there's been obviously a severe wound after an infection, an abscess, etc., how to actually repair tissue. And we can see here that after so dressing every 2 to 3 days with this media, after 3 weeks, we got nearly a full recovery of that. So it's amazing, really, really good. And here is an application as well for, again, for ones of you that are dermatologists, for atopic dermatitis. Again, it's not something some of us will be working with, but it's just to see really the endless benefits, and it makes you think then, why will it suit us in different aspects of our aesthetic medicine? One more, and this is another atopic dermatitis, and we can see again the resolution is incredible from the right and the left side. You can see the photographs there. And then obviously we go back now to what we do in our clinics, how do we use it, and how we can. So as we said earlier, the main key star for our clinics will be the professional serum. We use this daily in our clinic, and we use it, as we said, because we know that it's going to significantly reduce swelling and redness, and of course, downtime. And as we know, if you get severe swelling, particularly in the periocular area, it is very uncomfortable. You can hardly open your eyes, and it feels like it's throbbing. So the fact that you get the improvement on swelling and redness is also going to make the skin the patient to be more comfortable. So really, we got a huge reasons why to use it. And like we said at the beginning of the day, we are going to use it, and obviously all of those procedures as mentioned. Obviously, I personally don't do the CO2 laser, which is why I put it on other, but I use it on all those, and I use it for 3 years. And as I was saying, is pretty much a must. In another couple of things that maybe with chemical peels or microneedling, if it's not very aggressive treatment, we don't necessarily use it every time. So we preserve it for those very strong TCAs, people with higher risk because of the skin types, or particularly phenol peels. But of course, for me on plasma BT, it's been a huge improvement, and sublative radiofrequency and dermapen. In those, definitely is part of our protocols to always use it, because you always have got at least a week of downtime, and now we have reduced it to maybe 3 days. But even with that, the patient is better than they were before for those first 3 days when they couldn't even go out. So this is a really good photo of one of our colleagues where he's used it, and you can see on the photo where it's been just treated, is being applied with the calcine on the half of the face. I mean, look at the amount of swelling on the right eye area, and the edema and the redness, to compare to the left. I mean, the eye on the right is nearly closed. The one on the left is much more open. When we then look at the recovery, so when the skin is settled and healed, and probably because it's a PDF format, you may not have a very good quality to see, but there is a huge significant improvement on the quality of the skin as well as. So even if we are decreasing the downtime and improving the side effects, what we also are achieving is an improvement on the results. And as we all know from aesthetic medicine, we like combinations of treatments, because nothing on its own is perfect. If you combine a couple of things, you actually increasing the results and getting better results with it. And another one here, another split face. And this is obviously a more mature lady, so she's 77, which means obviously her recovery time is going to be a little bit slower. But only after 4 days on the area with the calcine, the swelling is pretty much gone. She obviously has got the redness, but with a mineral makeup, she could probably go out and no one could really guess. When on the other side, you can see this nearly whippy. This is still quite severely swollen and inflamed. And obviously that will be much harder to cover it up. And then this is one of my lovely patients. Again, I'm so sorry because it's a PDF. I just realized the photos are lapsed. So she went to have a treatment at a beauty salon for a photo rejuvenation of her hands with IPL, and she got burned. And she came to us about 6-7 months afterwards, and still have very black marks on the surface of the face. At the end, later, when we have a chance, I can try to upload the photo in a different way so you can see them. But what happened is we did the plasma shower in this case, followed by calcium. So we only use the plasma shower for a transdermal delivery of the serum, which you don't require because the serum works obviously perfectly well, but it was only just to add again something else because it was very severe hyperpigmentation post-treatment. And this is when she came for her second treatment. So again, very good. She was delighted because the marks are pretty much completely gone. And I think I was impressed that we could get these results in very short periods of time. And this is again one of ours. She didn't come to us because of the eczema. She was coming to us for something totally different. But when she was there, she was complaining of how severe pain was her both arms. She's a biker, so she was wearing leather, and it was summer, and it was very hot. So it was very weepy and painful. And she's obviously under the hospital for treatment. So I wanted to see what calcium, this is when we first had it. I wanted to see what it could do. And I offered her a free treatment just to trial it. And the following morning she came in and it was pretty much clear. And again, that's just one treatment, 10 minutes per arm, apply the serum. We gave it to her to take it home and apply that night and that morning, and that was it. Really, really good results. This one, for the ones of you who thinks it's being Photoshop, I promise is not. And the ones of you that know me well, they know I wouldn't do that. This was our very, very first patient. We signed a consent form, of course, for us to use this calcium and to trial it to see what it could do on its own. So no other treatments apart from, obviously, again, the plasma shower because of the transdermal delivery. Well, we could not believe that even immediately after the treatments, we took these photos, and when we look at them together, the girls, it was one of my staff did the treatment. She called me and said, "You can't believe this. Have a look." So the skin is plumper. It feels like she has some fillers, but she hasn't. The nasolabial folds and even the forehead lines, which are quite deep, are much softer. There was obviously an improvement of the plumpiness more and the radiance of the skin. What we could see obviously later on in time, obviously, is the skin quality does improve on its own. She's now coming every 4 or 6 weeks for one of these treatments, and now she is a total believer, and she uses the calcium cream at home twice a day. So it's really transformed. She doesn't need any fillers or any toxin. And I will say that I never believed in the past I could achieve with a topical product these amazing results. And again, this is one of our patients as well. And she has sublative radiofrequency, but only around the eye area. Usually for sublative radiofrequency, we used to have about 5 or 6 treatments minimum, depending obviously on age and the depth of the wrinkles. And we use that treatment for people that have the superficial wrinkles that we can see around her eyes, just to minimize and obviously soften them. So we decided again to start using the calcium, obviously firstly to reduce the downtime, of course, on the swelling, because you do get swelling, severe redness for quite a few days after sublative radiofrequency. The more aggressive, the more downtime. And what we then found is because then she was using the serum on the whole face, then when we looked at her, and she had 2 treatments here, and she came for her 3rd treatment that day. So the treatments here were done probably 4 to 5 weeks apart, because normally we do 4 to 6 weeks for sublative radiofrequency. So actually, after a couple of months, the improvement on the whole face is very significant. This is what we talked earlier about the plasma surgical. So this is not just to, as I said, to diminish the side effects, but also she only had the plasma surgical on the top loose skin of the eyelid, so literally on the top part. But we can see on this image that even all the eye area has improved very dramatically. It's just quality of the skin. She's got that sort of shine and reflection of the light, what we can see has dramatically improved. And another one of our sublative radiofrequencies, again for periocular, in this case, top and bottom and in between the eyebrows. She didn't want toxin. So incredible results for just, again, a sublative radiofrequency with just the Calecin serum. And again, she had 3 treatments, 4 to 6 weeks apart roughly. Yeah, very, very good results. But even her nasolabial folds and everything, again, have diminished. And this is just because she continued with the treatment at home, which is the Calecin, twice a day during the time where she had the treatments. But the sublative was literally on that upper face, only around the eyes and in between the eyebrows. And one more, and a much mature patient. And again, this is when she had already 2 treatments and she was coming for her 3rd treatment. And very significant as well is the improvement of the pigmentation and the color. So I had a question the other day on another webinar too, can you be treating for under eyes or the areas for dark circles? Well, it depends on the reason why we got the dark circles. So if you got the type of skin where the deposit of hemoglobin under the eye area is caused by hereditary conditions or because of the type of skin, then of course, no, because it's a different type of, but in this case, it's actually because if the skin is very thin and there is a volume loss, because you're increasing the thickness of the skin and you're improving the conditioning of the skin and it's more plump and it's more youthful, then suddenly when we know that the light reflects through the eye into the bone, that's what we see all that gray there. For that is perfect. Obviously, if you got severe accumulation of pigment in there for another reasons, it will help. So we will use it, but we will also combine it with some depigmentation products, of course, to reduce the pigmenting and the melanin in the area as well. And this is another one of our patients. And again, she had a course of 3 treatments. In this case, you see these dark circles, people call it, has dramatically improved because, as I said earlier, the skin here, the reason she had that is because it's very thin. There is no fat, so the skin is so thin and it's reflecting the light because there is no volume in there. So actually, by increasing the thickness and the plumpiness of the skin in this case, it will improve the dark circles. But of course, as I said earlier, it just depends on the type and why. And this is now Dermapen, which is very popular again in the clinics. We used to have years ago all these derma rollers, etc., which are quite painful. And when Dermapen came on first again as quite fashionable, the downtime was still an issue. And again, now what we find is that with this treatment, we don't have much of the downtime. You can use a mineral makeup after normally a day or 2 if you wish, and look at the skin texture. So if you're looking at improving of that texture, open pores, skin quality, the very, very fine superficial wrinkles, the only 2 treatments available is Dermapen and HIFU. And of course, not everyone can tolerate HIFU or would like to have machines in the clinic. Like HIFU is not cheap. So Dermapen is a really good alternative. It's not expensive to perform. And for the patients, also very affordable, which means you can have very good results for the skin quality and the skin texture. Usually we'll recommend obviously 5 to 6 treatments in general. Before we used to say 6 to 8, and now sometimes even after 4, we're finding very, very good. If they continue with the Calecin at home, it's shortening the number of treatments we are requiring. So, which then takes us now to home care. And as I say, I will try to encourage everyone who is having these type of treatments to obviously use this cream at home. This is my #1 choice. And as we saw earlier, it's because you got the 50% of stem cells. So it's a little bit stronger. More of our mature patients are looking for an enhancement on the skin elasticity and the skin quality and a bit of a lifting effect which you can create with here. It will be a really good complement as well on injectables. So if you're doing your non-surgical facelifts through fillers, of course, if you're using Profilo as well, which will give you a lot of hydration and it's a viral remodulator and improves skin quality. If you add something like this as well, which is your stem cell, you're going to, of course, improve the results as well. So it's good for injectables, but it's good as well for your HIFU treatments, and it's good for any of the treatments we have seen already previously as a complement for house treatment. I wanted to share with you some of the pictures from around the world from colleagues of ours where they have used it. And this is just the multi-action cream with no other treatments in-house. So in all of them, what we will see is the improvement on the skin, and it's more noticeable on jawline because you get more definition because of that lifting effect. Obviously, the cheeks, they look like they've been filled sometimes, nasolabial folds, and obviously eyebrows. And again, in this one is another lady, but even the skin tone and the skin quality is that glow and that sort of juicy look of the skin we can see on all these images. I think it's very impressive for just, as we said earlier, a cream only. But this is an FDA approved. It's got a lot of studies behind. We're not talking just a normal moisturizer. This is a very key, important product, which I think must be a must to have in your cover. And another patient here. And these types of skin are quite difficult to improve because it's quite heavy tissue there, and it's very hard with fillers to give a good result. And sometimes patients will be disappointed if you try to say, in her case, fill her nasolabial folds. It wouldn't have looked great. Maybe a little bit of cheekbone enhancement will help, but she doesn't have much need either for fillers on her jawline because it's quite difficult. So really, things like that is a great alternative to get patients happy with minimum cost. And this is another patient of ours after 6 weeks. And you can agree with me that it's incredible results. I know she's smiling a little bit on the other picture, but even when she's smiling, her smiley lines and the eyes around the wrinkle, you can see that a lot less noticeable than before. And of course, the last but not least is our hydration cream. So if you got someone with extremely dry skin and you can only choose one product, then I will say this one. You still got you 40% of stem cells, but of course, it has got the added hyaluronic acid. So you're going to get that more glow and radiance and hydration on it if you have to choose just the one product. Of course, if you can choose more than one, you can combine it with your serum as well or with the other cream at home. And I just wanted to show again some images from colleagues again around the world with the use of just this Calisim cream. And these are 6 weeks after images. And again, we can see that improvement on the skin quality, the plumping and definition. And as I said earlier, it does look like they have their cheeks filled, but they haven't. It's just because it's more plump and youthful, then it creates a vectoring and a lifting effect on there, which is why also happens on the jawline, because you get that lifting and vectoring effect from that lateral vector. And we can see that one on this side profile here. Even that lines on the side of the mouth are softened. And another one, again, a very, very difficult case for fillers in this one because, again, it's heavy tissue and Asian skin is much firmer, it's a little bit thicker. So they're very hard to reposition. You have to be obviously quite an expert and use products with high G prime and key points to maybe relocate and reposition the tissue. To actually achieve this with obviously just a cream at home, I would say is very, very good. And just finally, a young patient who thought that she needed maybe fillers or something to get rid of those fine wrinkles under her eyes. You have to agree with me, she doesn't really need any fillers. She's young, she's gorgeous, she's beautiful. Her skin was not great, but after just 6 weeks of using the hydration cream, we can say that the glow, the happiness on her face is obvious. So it was a very, very good result for just, again, one cream. So one more. And again, these are dark circles. So she was concerned and she looked tired and exhausted and she wanted to fill under her eyes. And again, I just thought that a filler for the cost will not really give her that perfect result that she was looking for. Because, okay, you may improve a slight, if you got the groove and it's there, positioned and permanent and you can see it, of course you can use a filler, but in this case it was hardly noticeable. It's more the color of the skin, so that dark circles she was talking about. So you have to agree that by using something like this will actually improve the skin condition to make her look more fresh and better without actually spending very much money. And I think with that, I hope I have covered everything today to do with the calcium stem cell technology. And I'm sure we're going to have a lot of questions. I'm going to pass it back to Vicky again.
Hello, thank you so much, Beatriz. Well, that was really comprehensive and some incredible photos there, really impressive results. You talked a bit, obviously, you talked about the separate aspects of the home care and then using it in conjunction with, for like encouraging healing post-procedure. When you incorporate it with the procedures, do you just kind of add that into your cost of your procedure and just apply it in clinic and then give it to people to take home? Or do you give them the option?
No, absolutely. That's what I said. A few key treatments, we made it as part of our protocol, which means it's part of the cost. So like with the plasma BT and the macroneedling, etc., we got as a fixed price. That means includes the serum and they take it with them. So they use it twice a day until run out, which usually is nearly a week anyway, because you only need a very small amount. The one we use the most amount in clinic will be obviously when you're doing a plasma shower, because the lady we said is not being touched up, it's just plasma shower. We did use 2.5 mils of the bottle, which is half. And then we tell them to continue. So that one they will now very quickly because it's a full face. It's a different thing. But when you're doing upper eyelids, it's only 2 drops. It's a very small amount. So the bottle is pretty much intact. And because they come sterile and they come individually wrapped, it's nice to open and say, look, this is now yours. We do tell them to keep them in the fridge and to keep them non-extreme temperatures because it's important for the quality of the stem cells to stay fresh. And then just to use it twice a day on a clean skin.
Fantastic. Again, it obviously makes a dramatic difference.
Oh, absolutely. And that's why we decided it's worth we don't make money with it. We just absorb the cost as part of the treatment, but it does make a difference because people are happier because they don't have the downtime, but also the results are improved.
I think that's the key thing, isn't it? Downtime is something that we always want to be addressed, and
too busy these
sometimes
days.
It's unavoidable. But it's great if you can minimize it. So someone was asking on Facebook, can any of the products be used in conjunction with carboxyfacials? I'm assuming you can use these products in conjunction with any treatment that you're doing.
With any in-house treatments, and I suppose I focus mainly on the ones I use personally, just because that's the ones I got the knowledge, but they can be used with any procedures. Totally, because as I said, the serum is sterile. So you have to remember that you can put it on a wound. You can put it on if you actually injure the skin with dermapen or whatever you're doing, you can use it. So, and if you're not using it on invasive procedures, so say they come and have a very light chemical peel, which you don't need to use it because you don't have downtime, you can still say, oh, when you go home, you can either put them on a cream, or you can say, okay, I'm going to give you a serum to use at home for a number of weeks just to improve the skin quality. Fine. You can combine it and do protocols as you like.
Fantastic. And someone else was asking if it's suitable for all skin types. Actually, they've got a second part of their question, but we'll answer the skin types first. And then
and that's what's great, because we do know that the skin types 4 and 5 and 6, the higher we go in number, the more risky to do procedures, the most risk of post-inflammatory pigmentation. And that's where I think, particularly on things like dermapen and the plasma BT, has been a dramatic change for us, because you are reducing the risk of post-inflammatory pigmentation because of the healing and downtime. Of course, you're still going to have to use your skills as a professional esthetician or aesthetic doctor or nurse, where actually you got your knowledge to how you use your parameters so you avoid the risk. But this is just a complement to reduce the downtime and to help the recovery time. And of course, in any skin type.
Fantastic. And they were asking as well, you mentioned minimal cost. What sorts of costs would patients expect to pay? I guess the costs of treatments and things like that are different, aren't they, depending on...
Yes, I think what I meant is, if you're coming for fillers on a tear trough, you're going to spend at least 2 mils. Depending where you are in UK, you may spend the cheaper fillers, maybe 250, 300 to 500 to 750 if you're in Harley Street. I don't know, depends. In Somerset, I don't mind saying, we charge about 350 average for 1 mil and 650 for a couple of mils. But then we're in Somerset, we're not very rich here. So, so that's just 2 mils, 1 treatment. So if you think about how much a dermapen will cost, it's an average of what, 150 maybe? Some people are charging 200. Some people may charge 99 if you're in cheaper areas, depending where you are. I mean, It varies, but it's a lot
A lot
cheaper.
of factors, aren't there, that
You
come
are
into
improving
play.
a full face with 2 mils of filler. You're only doing a very small amount of the face.
Yeah.
So yeah, it's cost effective for long term because of the stimulation of collagen and improvement of skin quality for the whole face. And later, maintaining results is very easy because once you've done your course of, say, few dermapens or few sublative radiofrequencies, you don't need to go back to that. I mean, normally we probably suggest every 3 to 4 months as a maintenance if you wish, and you are more mature, to have one treatment, but it's just one. So again, that's very cheap treatments. We charge anything from 50 to 100 pounds with sublative. It's not a lot for small areas. So yeah, it's very cost effective.
Fantastic. And someone's asking can the serum be used during microneedling? So actually during the procedure itself? Or is it
I think it's too expensive to be used during. I think you got beautiful carriers, which is a normal non-cross-linked hyaluronic acid, which is a sterile, and you can use, because you use quite a lot of products during the procedure because you want the needles to roll easily. I think it's just perfect for after. So use your normal serum recommended by your brand. As I said, normally it's a hyaluronic acid base, which it glides easily. When you finish your treatment, then you apply your Calisym all over your face. And as I say, full face is between 2 to 2.5 mils. So it's not a lot, maximum, depending obviously of what area you treat. But for a full face, more or less, you think 1 mil, roughly.
Yeah, that makes sense. And I guess if you've just had microneedling, you're going to get more absorption anyway of the ingredients.
Exactly, because once it's been done, you see this, it will soak very quickly. So because it's come with a pipette, you just make sure you do little amounts, forehead, rabbit, side rabbit, side rabbit. So then you go into the difficult at the nose and around the mouth slowly, rub it well, let the patient, some people use masks, some people don't, but absorbs really fast. It feels quite nice, quite immediately. And what it's doing then is, because we do get a lot of swelling immediately after these procedures, like the face start feeling quite burny and quite uncomfortable. And if you don't do anything the day after, you woke up and you look like a Beatriz, you look horrendous. I mean, I had it done. It was very scary.
Having tried lots of treatments in my time, I know what you mean.
It's horrible. And actually, it's not that comfortable, isn't it? But the results are good. So yeah, when later you can put the serum, what you feel is they don't get that immediate discomfort and that you will expect without it. So for the ones that you are not believers, do it yourself and just do a split face. Have a look. Or do a hand and do the hand no, or something like that. That'd be quite good. Yeah.
Yeah. Fantastic. Well, thank you so much, Beatriz. I don't think we've got any more questions, but we're almost perfectly on time, so that's good. If anyone does have any more questions they think of, and please do get in touch with us. You can get in touch on the Aesthetic Medicine Virtual Week Facebook group, and we can always field any questions that we get afterwards to Beatriz. Thank you so much for joining us this afternoon.
Thank you, everyone. Enjoy the
really
sunshine this afternoon.
Yeah.
See you soon.
See you soon, Beatriz. Thank you very much.
Bye, everyone.
Bye. Bye.